Determination of sodium and potassium in serum. Coming to the test principle of sodium. Sodium is precipitated as triple salt with magnesium and uranyl acetate. The excess of uranyl ions are reacted with ferrocyanate in acidic medium to develop a brownish color. The intensity of the color produced is inversely proportional to the concentration of sodium in the sample. Coming to the requirements, we have sodium potassium kit, test tube, micropipette. Then to the procedure. First we have the precipitation step. Take 2 test tubes and label them as standard and test. Add 1 ml of precipitation reagent L1 to standard test, 20 microliter of sodium potassium standard in standard, and 20 microliter of sample in test. Mix well and let it stand at room temperature for 5 minutes and centrifuge at 2500 to 3000 rpm to obtain a clear supernatant. For color development, take 3 test tubes and label them as blank standard test. Add 1 ml of acid reagent L2 to blank standard test, 20 microliter of supernatant to standard and test, 20 microliter of precipitation reagent L1 to blank, and color reagent L3 of 100 microliter to blank standard and test. Mix well and incubate for 5 minutes. Measure the absorbance of blank standard and test against distilled water at 530 nanometer. Coming to the calculation, sodium concentration in the sample is equal to absorbance of blank minus absorbance of test by absorbance of blank minus absorbance of standard multiplied by 150. Next, on the principle of potassium. Potassium reacts with sodium tetraphenyl boron in a specially prepared buffer to form a colloidal suspension. The amount of turbidity produced is directly proportional to the concentration of potassium in the sample. Take 3 test tubes and label them as blank standard test. Add 1 ml of potassium reagent L1 to blank standard test, 20 microliter of deionized water in blank, 20 microliter of sodium potassium standard in standard, and 20 microliter of sample in test. Mix well and incubate at room temperature for 5 minutes. Measure the absorbance of the standard and test against blank at 630 nanometer. So the potassium in the sample can be estimated by absorbance of test by absorbance of standard multiplied by 5. Coming to the reference range, sodium is equal to 135 to 155 millimole per liter. Potassium is equal to 3.5 to 5.5 millimole per liter. Coming to the clinical significance, sodium and potassium are the major cations of extracellular and intracellular fluid. Sodium maintains the normal distribution of water and osmotic pressure in various fluid compartments. Potassium influences the acid-base balance and osmotic pressure including water retention. Increased sodium levels are found in severe dehydration, excessive treatment with sodium salt. Decreased levels are seen in severe polyuria, metabolic acidosis, diarrhea, and renal insufficiency. Increased potassium levels are found in renal failure, dehydration, shock, and adrenal insufficiency. Decreased levels are found in malnutrition, gastrointestinal fluid loss, and hyperactivity of adrenal cortex. Thank you.